7 out of 10 Americans struggle with being overweight or obese, and now millions of Americans have turned to drugs like Wegovy, Mounjaro, or Ozempic for help. Many have seen significant weight loss, but at what cost? Is there a downside to taking these medications? Dr. Swathi Varanasi-Diaz is an integrative pharmacist, natural medicine specialist. Last year was named one of the 50 most influential leaders in pharmacy. Doctor, thank you for joining us. We appreciate it.
Thank you so much for having me.
Okay, we're talking about a family of drugs called semaglutides. Can you just give me kind of a thumbnail of what semaglutides do?
Yeah, so the class of medication is called glucagon-like peptide-1 agonist. So it's a very fancy term. Really what that means is that it mimics, when you take these drugs, it mimics a hormone that plays a crucial role in glucose metabolism and appetite regulation. So that's why, even though initially these drugs were investigated for type 2 diabetes, they found that people that were taking these drugs were losing upwards of 15% or more of their total body weight. So that's why people are so excited about taking them right now. And really, as you mentioned, there's quite a weight, management discussion happening
Sure.
right now.
And if you're on these, do you have to remain on them for the rest of your life?
So the way that they're FDA approved, yes, they are FDA approved to be for long-term use.
Okay, so how it is injected generally?
So it is, there are different formulations. So they have the injection, so it's considered like a subcutaneous injection. So that is, right under the skin. But they also have oral formulations now too. So, it depends the type of drug and what you're being prescribed.
This was a diabetes medication to begin with, and they found, as you mentioned, the weight loss component, and that opened a whole door here. The question is, what are the downsides? This is what everyone wants to know. It sounds like a miracle drug, but we do have people who have gastrointestinal problems with it, headaches. There are other things kind of associated with this. What are the potential downsides?
Yeah, so I would say when people are taking these weight loss medications, there are 4 big red flags to watch out for. One is related to, as you mentioned, the gastrointestinal issues. One is related to accelerated muscle loss, and the other 2 are off-label misuse and mental health.
Okay, so when you take these, you talked about kind of the description of how they work. They kind of suppress some areas of your brain, right, that regulate hunger. So you just don't want to eat. Is that the long and short of it?
That's part of it, yes, is that people lose their excitement and they lose their drive to eat. And so also, when people are taking them, they feel fuller quicker. And so the idea is like, okay, if you are taking these medications, how can we figure out how you maintain a healthy lifestyle inclusive of diet, and oftentimes, how we can incorporate things like movement and supplements.
Do you have to kind of watch or get with a nutritionist to figure out how to make sure you're eating properly so that you're getting enough protein, getting enough carbs, whatever you need for your body chemistry? Should you work with somebody to try to augment what's going on with the weight loss drug?
Yes, I would suggest that you work with someone. And in that particular case, it's, how do you optimize exactly what you mentioned, the protein, the macronutrients like carbohydrates, and how we can think about eating whole foods, oftentimes from the perimeter of the grocery store, thinking about produce and high quality protein and high quality fiber.
The people who are on this, can they continue to work out, or do they feel sluggish because they're not getting as much food, they're not eating as much? Do you have to balance that out?
Yes, movement is really important in cultivating this healthy lifestyle, especially moving forward if this GLP-1 is in your life. And so I always recommend a combination of, something that gets your heart rate up. So that could be tennis for some people that could be walking, and then combining that with some sort of resistance training. So thinking about, it could be light weights, but thinking about how weights can really help fulfill and keep your muscle health great.
Do we have long-term longitudinal studies on people to know what the long-term effects of these semaglutide products, Wegovy, Mounjaro, all of the above, what they may, what, you know, effect they might have on your health down the line?
So at the moment, we currently do not, which is why I think discussing things like nutrition and movement, as well as, what sort of supplements can help people who are taking these GLP-1s. In particular, the if you are taking these GLP-1s, I recommend 3 supplements: omega-3 fatty acids, which you've probably heard of. You can get that from salmon, but you can also get that in a fish oil pill. The second one is amino acids. You can also get that in a supplement or from food. And then the third one is one that you might not have heard about because it's newer, but it's highly studied, and it's called fortotropin. It's a natural compound derived from raw fertilized egg yolk, and clinical trials showed that it boosted muscle protein synthesis by 18% in adults who are not exercising.
That sounds like a good thing, whether you're on these drugs or not.
Yes, exactly.
Okay. I did not realize, I just didn't know this. Obesity has been recognized by the AMA, the American Medical Association, in 2013 as a disease. I didn't know that. I mean, obviously, we know about all of these other ancillary issues with obesity, but I didn't know obesity itself was considered a disease.
Yes, obesity itself is considered a disease, and that's simply because it's just so multifactorial. There's so many components when it comes to how people are managing their weight and what they can do to really transform their life. And we're just finding that the way that, the standard American diet and other ways to eat and our lifestyle now just translates to weight gain, unfortunately. And so thinking about nutrition, thinking about GLP-1s if it is the right choice for you, and thinking about what supplements that you can take in addition can really help you, stay out of that 7 out of 10 group of people. Okay,
for just identifying who is the target person for this, who would you say are the people that you would say, yes, this is a good fit for them?
So the drugs actually, Ozempic and Wegovy are actually only FDA approved for certain patient populations. So they're FDA approved for if you have a BMI, or that's like a body mass index of over 27, that's considered overweight, or medically overweight, and you have another chronic condition with that. So that could be heart disease, or something else. And then, so you either need to fit into that population, or you need to fit into a population of having a BMI of 30 and above, which is considered medically obese. So I think for patients who fall into those 2 subcategories, who have tried everything that they can, from lifestyle to nutrition to everything, and they're looking for something to jumpstart their weight loss journey, Ozempic, Wegovy, these GLP-1s could be a great fit. It's really with this off-label misuse of people considering taking these drugs who are not in these patient populations where I get concerned.
Yeah, they just want to look good at the beach. Okay, a congressman told me recently that these drugs, this kind of approach, could be the biggest game changer in our entire economy of lowering the cost of hospitalization, medical care, if we can get obesity under control. Do you see this stuff as a panacea for that?
I don't know about panacea, but I do think that GLP-1s could play a role in, decreasing hospitalizations and increasing what we love to call in the space our health span. So that's not only our lifespan, so the number of years that we're living, but how are we living in those years, and what is the quality of life? So thinking about health span and decreasing hospitalizations, thinking about improving overall quality of life. Yes, I think GLP-1s for the right people could do that. But if people are taking GLP-1s, again, you can't just take it as a silver bullet. It needs to be in combination with the right nutrition, the right movement, and the right supplements.
Dr. Swathi Varanasi-Diaz, integrative pharmacist, natural medicine specialist, we really appreciate your time. Great to see you.
Yes, thank you so much. And if you'd like to learn more about anything that I mentioned today, I host educational webinars on MYOSMD.com. So that's MYOSMD.com. So you can check out more there.
Okay, great. Doctor, thank you.